Hey all, hi. Well, I'd like to introduce Jordan, which we'll meet in a second. And today we're going to be doing a case study. And I haven't met Jordan before. I don't know anything about why we're here. Don't really understand what he is that he wants from his session today. But I'm sure whatever he's going to be going through and whatever we'll be sharing is going to be valuable in some way. So let's meet Jordan. Jordan, say hello to everybody, and here we go.
Awesome.
Okay, well tell me why you're here, man.
Yeah, I've been exploring my body and my musculoskeletal system for 2 and a bit years now.
Yeah.
And I feel like I've come a great way on that journey, and there's a
Yeah.
lot more that I want to achieve in terms of familiarization with my body and just clearing a few blocks in my muscular system and
Okay.
exploring the fascia more.
So when you say you're exploring your muscular skeletal system,
Mhm.
okay, and your fascial system, what is that? What does that mean? What are you doing? Tell me what that is like for you.
Yeah. I was really interested in functional patterns, so I was looking into some of the work that Naudi was teaching, and if you're familiar with him at all, and just learning to be in better posture,
Uh-huh.
and more functional in terms of my movement, and
So did you get into? Are you talking about fascia and fascial trains and stuff as well?
Yeah.
Are you getting into the
Mhm.
fascial planes and?
Yeah.
And so, what other body work techniques have you had done to your body?
I've had a few myofascial release sessions before.
Myofascial meaning like just specific myofascial or more specifically Rolfing?
Just general
General myofascial.
Yeah,
Okay,
exactly.
gotcha. Yeah.
I've been quite interested in yoga for a while. So I've been practicing that a bit.
Yeah.
I feel like I'm very flexible in my body.
Yeah.
But having more strength in certain joints,
Yeah.
I think will be quite beneficial for me
Sure.
going forward.
How old are you?
25.
Yeah, right. So, do you have any injuries? Do you have any traumas that you have problems with that reoccur on a regular basis that you need help with?
Yeah, a couple bits and pieces.
Yeah.
I rolled my ankle a few years ago, and that's
Uh-huh.
been like super twitchy since.
Right.
It's never felt the same. I snapped my ACL, my right ACL.
How'd you do
In
that?
2018, skiing, unfortunately.
Yeah.
Had surgery on
You
that.
had surgery.
It's been good, but sometimes I feel like my quad pulls it out of alignment a bit, and so it can seize up if I'm squatting or walking downstairs.
How long ago was the surgery? The
Uh,
skiing accident, I
yeah.
should ask you.
2.5 years
surgery,
ago.
2.5.
mhm.
And how long after the accident did you get the surgery for it?
Within a month or two.
Oh, okay. Okay. Yeah. Anything else? Any other kind of major injuries, like the things that you can recall?
I've had scoliosis for quite a while, and so I guess that was the main trigger in terms of exploring the functional patterns work, so that I could straighten out
So
my back.
scoliosis since you were born, is that what you're saying? Sort of.
Effectively, I
Yeah.
feel like.
When did you discover scoliosis in your? Who told you have scoliosis?
The trainer that I was working with in functional patterns made it quite clear to me. I knew that I'd had like knee pain and some hip pain previously, and
Yeah.
it was just something that I'd always sort of experienced growing up.
Yeah.
But then as I became more familiar with my posture, then I realized how by actually learning to work with my body, I can strengthen it and
Yeah.
I can re-engineer it.
Sarah, can I just focus in on me for a second?
Mm-hmm.
So what's really interesting is that when we listen to what other people have to say, when we're in, let's say, the beginning part of this conversation, this consultation is so important because language that people use to describe what it is that they experience, okay, it sets the framework for how they experience what they have. And the crux of the language that most people use to discover what it is that is in their body is not really their own language. It's language that they've assumed or have been gifted from other people. And so in Jordan's case, which he's been gifted this word of scoliosis from somebody who's like gave him this word, right? And then what he then experiences from that point forward is the experience of this word, whatever it means to him, however it means in his body. However, we don't really know if he has anything to do with that word at all, scoliosis. We don't actually know anything. And so from the perspective of like, let's say myself working with Jordan, I actually just am listening. If he shares with me this word, I write it down. I wrote it down, but I write it down in not in jest, but as like a grain of salt, because we don't really know what is actually happening. So often someone says, "Oh, I have pain in my stomach." I said, "Okay, you have stomach pain. Show me where the pain is," and they point. They point to the middle of their belly. Your stomach is up here on the left side, you know. So we need to really use not caution, but we need to use a lot of awareness when we walk around language. Language is important. So okay, so moving through additional injuries, you've got the ankle, you've got a knee injury with surgery, you have this thing, scoliosis, which puts an idea in your head, which, by the way, it could have been a gift. Like I said, gifted you the word of scoliosis, which you then described to me that it has caused you to go on a path, right? So like that's a great gift, even if it's wrong.
Of course.
Yeah, it's an awesome gift because it's causal to that your search. Yeah, so we're just not going to be stuck in that because that's a gift of the past. Yeah, moving forward, we're looking for new gifts.
100%.
Yeah. Okay, so any other issues? Any other like traumas you remember as a childhood, anything like that?
No, nothing too severe bodily wise.
That's okay. Well, we're going to work through your body. Okay, and we'll. Have you had chiropractic before?
No.
No. Okay, even more interesting because you'll be very surprised at all the cool things that are about to happen. Okay, can I have my attention back into the camera? So here's what we're going to do. Jordan is an open palette. He doesn't have any, ideas about what is about to happen in the session. As many of you who do get chiropractic sessions have your experience to kind of unfold in front of you. What you're about to see is probably not your typical experience. And there could be many other experiences that you could have that are going to be far greater than what's about to happen today. I have no idea. But what I will share is that just from a blank sort of like of canvas that you can create whatever you want to create. And what we're going to do is work through his body. We're going to identify areas of his body that are causing neurological tension, so tension in his nervous system. And we're looking at some basic programming of his nervous system. When we think about the body as a computer, we're going to do that. Then we're going to I'll go through his instructional system, and then we'll just see where our starting point is, because I really don't know what is going to happen. So, ready? Let's get rolling.
Great.
Is there anything that I should know, like that you're uncomfortable with, like teeth tissue work or anything like that?
You go for it. Over the last few days, I've had a bit of an earache. It's come down into my jaw, but you're welcome to go.
So
for it.
ear and your left ear ache.
Yeah, but it's
in your
fed
jaw.
down my eustachian tube.
Do you get like TMJ or anything like that? Temporal mandibular joint pain or dysfunction, is it a regular thing for you?
No, exactly.
So like your jaw joint, does it cause you pain on a regular basis?
No, I think
just
it's more so like a bit of an ear infection.
from the ear.
From swimming. Yeah.
So just also to kind of come back to that, adults who have ear issues, in other words, they accumulate water from when they swim quite a lot. That's understandable. But when an adult starts to get regular ear pain, okay, not necessarily, for example, like a buildup of wax because of the water, but because you actually have an issue, either how often are you swimming?
A couple times a week.
Yeah, so if he's only swimming a couple of times a week and you're an adult, you're only in the water a couple of times a week and you're having issues because water in your ear, it's trapped for a reason. And in an adult, because the ear canal is in a certain direction, it points downwards, it should be really relatively easy for water to escape. And if it's not escaping or it's causing some pain, there's a reason why. There's tension that's being created in that. Unlike a child can get an ear infection for any number of reasons. But their ear canals point upwards in an upwards direction, so gravity doesn't take the water out. And so for an adult to have that, it's a key indicator that there's something happening potentially in and around his neck and skull that we might look at. I don't know. We'll find out. Let's go. Jump in, face down.
Shirt on off?
Just leave your shirt on. It's great. Yeah, you're cool. If I want you to take your shirt off, I'll tell you later on. Okay. Okay, just put your hands here on the side. That's cool. Okay, deep breath in for me. And deeper than average exhale. Good, deep breath in again. And then deeper than average exhale. Okay, we don't have a scoliosis, okay? You're good.
Okay.
You might have a little bit of lateral movement here in your lower lumbar spine, but nothing too incredible. Relax your jaw and lengthen the base of your skull. Oh yeah, there you go. You just dropped in. Nice work. Relax your jaw again. Big breath in and exhale out. Well, there's definitely something going on occipitally, his cranium, the way his actual head sits on his neck and integrating into the front of the neck and into his jaw. There's definitely something happening in terms of here. And this pattern moves through his body, moves into his left side, moves into his right side. They don't come together, they actually spread apart. When it comes through his right side, it comes out through the back, and when it goes through his left side, it moves out through the front. Well, that could be confused for the scoliosis kind of twist that might or might not be happening through spine. A lot of tenderness in his like mid-thoracics. Yeah, tender? These ones?
Yeah.
Are they not? If they're not tender, you can tell me they're not tender. I could be wrong. But yeah, that's quite irritated in there. Big breath again through the belly. Relax your jaw again. Okay. It's a bit of a pelvic twist. Okay, so a few things going on, but here, this is all just, we don't know what's happening just at the stage. Maybe we'll just start walking around so you can pop that off.
I'm gonna do that.
Yeah, that's okay. And then you can just pop that up and walk around with it. Yeah, just pull. Good. Alright. Turn your head to the right. What we need to do is we need to make sure your nervous system is clear. Turn your head to the left, but it's not being clouded with old problems from another day and age when you had issues. Turn face down when you weren't on the path. Even when you're on the path, you have issues. So at the moment, we have a significant short leg on the left side. So if I just use my fingers as an indicator, I'm using the same landmark on the heel. And so that landmark is leading me to just seeing there's about an inch or so deficit here on the left side. It's really short. And you know, like when I'm holding your legs, like what I feel is I feel your whole body. I feel everything from here to all the way up into your neck. It's almost like having a rope attached to something in the distance. You can pull tension on it and you can feel it. I feel like all my fishing skills have come into play here. You know, when I was a child, my dad taught me how to fish, and you can feel the lure on the bottom. I feel like all my skills here coming into play. So, interesting down that side. Let's get you on your back face up, and we'll do a few more things and just get an idea of what's going on with your body. I'll have your arms over your head this way, please. That's great. Here we are. We also have like a tension pattern moving through the left side of his body, and that's kind of coming together deep down in the iliopsoas. It's passing through his inguinal ligament and then moving into the internal portion of his femur where the lesser trochanter is, and that's the attachment of the hip flexor. So it's happening on the left side. Right side seems pretty open, and it's causing contraction at the diaphragm. So his diaphragm's not lifting quite right here on the left side, and his rib cage is being held down as well. But before we even get into treating that or coming across and like digging into that to find out that it's an issue, we need to get his nervous system straight. So we're going to do something called injury recall technique. Okay, so we'll just do a muscle test here. Push against my hand, push towards the door. Good. So it's a very weak, that muscle's weak. It's not neurologically active, right? And so that's okay, but I should be able to make it neurologically active. Let's see if I can do it. So now I'm asking your body if it's following the rules of your neurology. Like, is it really following the rules it's supposed to follow? We're going to find out. Push against my hand, push. And so not really. Like, do it again, push again, push. One more time, push. Okay. Okay. So his nervous system is really confused. His nervous system doesn't know whether it's sort of like fighting for its life or if it's going to get worked on. And it's kind of moving back and forth between what we call fight or flight and then rest and digest, okay? So let me explain to you how this works, and maybe come around this way and you can work from this side, like facing me from here. Yeah, so, yeah, better. Every cell of your body has the ability to hold a memory. So if we look at what you were made out of, or your quantum particles, yeah? When we take it down to that level, absolutely every part of you is the same. There's nothing that's different. But what's different is that we take these same building blocks and we build libraries like the brain. And that library is built to hold long-term memory, if that makes sense. So you have access to it whenever you want. Like, you know, if you put a file in the library and you want to go get it, you know where to go get it. This is the computer storehouse for everything that you have. It holds short-term things, long-term things, and it does good for that. But every part of your body actually can hold memory. So you get an injury, okay? And this injury, now from your caveman days, is a very primal, very primitive sort of neurological state. And so what happens is you get this injury, and sometimes the body remembers the injury. So you heal through it, but the body recalls and has a memory stuck in the structure. So as the cells, you know, some cells are eaten up and consumed and then sloughed away through the lymphatic system, while others are being built and then made from the old cells. And so this replication process is sort of like ancestry. It keeps passing memories along. Sometimes the memories keep going. And so you twist your ankle, you hurt your leg, and there's this memory of the injury even though you heal it again. And so every time you step on your foot or you push pressure on your ankle, the action, the activity of it actually activates that memory at a very low subconscious level. So your unconscious mind goes, oh, I remember that injury, so I'm going to go into fight or flight. Now the reason why it does that is because if a saber-toothed tiger was to jump out from the corner and you had your bad ankle on the ground, your body would be in fight or flight state already before you even know that the tiger's there. Mm-hmm. And then all of a sudden you see a tiger there and you're ready to react, and so you have that immediate impulse that you can react from. And then you stay in fight or flight for a while if it's a true threat. Now if it's not a true threat, the moment that the pressure is off, you go back into your default mode. So then everybody, we're constantly walking through or working through this default mode system, whereas that you're going through patterns of fight or flight or stress during the daytime while certain parts of your body are under stress and duress that you're not aware of, and then you're going back into normal sort of parasympathetic, relaxed, calm, rest, digest state, and you're flickering back and forth. Now, some people just stay in fight or flight all day long, all the time. That's most 75%, 80% of people who have not been treated like this. They all flicker through back and forth. So what we need to do is stop that, and it's very simple. You think about the memory as a record, and so this record has a memory, like a pattern to it. And so what we're going to do is I can stimulate that either by me making touching stimulation, or you completing a circuit with your hand. So we're going to do both, okay? And so I'm going to stimulate the memory, and then I'm going to use one of two switches. I'm going to use a switch here in your foot or a switch in your skull that act like gyroscopes in a plane. And so when I push that switch, just like that, it floods your nervous system with millions of signals, because this is what controls balance. And so when I go like this, you don't know it, but just whoosh, signals everywhere. That's what allows you to stay on one leg. Yeah. So what we're going to do is scratch all these records that are there. So some repeated process, hand off your body. Let's look at this again. Push against my hand, push. Good. And so now he goes, see what happened is that before, why I said he was confused is because that was off. And then I tested it, and then I grabbed his ankles again, and it turned back on. Now, it's very rare that happens. It's very rare that especially with someone who's never been treated before and has had injuries, that is going to work like that. So here's what we're going to do is we're just going to test the ankle specifically and see if there's other issues, and we'll get a strong push. Not there. Stronger response. Push. That's a huge response, right? So that moves you from neurological off, which means like the nervous system has got a delay or softness to it, right? So push, there's a delay. And then there's neurologically on, which now then when I stimulate this old injury, there's no more delay. And then push, and you're immediately on, yeah? And that means that has now thrown you into fight or flight, and it's only available for one impulse. So because it's not lasting, it's only lasting if the threat lasts. Because there's no threat, you go back to your default state, push against my hand, push, which is back off again. Yeah. Yeah, and so you keep flickering between these on-off states. So every time this foot touches the floor, it puts you in. The moment it comes off, you go out. Mm-hmm. And you just keep doing that on and off all day long. Now, what if you had like 20 of those problems? So the thing is this: not every injury retains memory. This is important. Just because you had bad injuries doesn't mean you have bad memories. Just because you have small injuries doesn't mean you don't have memories. Okay? And every person holds memory different, whereas one person holds all the memories, and some people hold none of the memories. Very, very unique per person. So what we'll do is we'll just start resetting this. I'll just reset this side. We'll start with that. So it's just the process of stimulation of this particular joint and your nervous system. And we'll just flood your nervous system as it thinks like, oh, I know these signals. And we'll just flood them with other signals. And then the computer inside your brain doesn't know what to do with it. And so it just wipes it. Just wipes it out of the tissue. And it's no longer a drama. And so we'll just reset your nervous system, and then let's go back to a normal test, push against my hand. And so you're back off again. And then let's re-stimulate this area to see if we're back. Push. So it's still on, so there's more to this issue. You said knee surgery as well? Okay. Let's move through this a little bit more specific, because you have a lot of scarring here, so.
Yeah, so there was they did the ACL, and then they added a synthetic piece between like the upper and lower and that. So between these two, there's like a piece of synthetic in there.
Oh, yeah,
so
yeah.
Act as
Yeah. Okay, gotcha. There's a little bit more going on here than your average sort of like knee ankle trauma. So we need to what we need to do is get a little bit more specific. And actually work on some structures. Against my hand, push. Cool. I will just go through this. Push against my hand, push, go. Yeah, so we're sweet now. Okay, yeah, it was just very specific for that. Now, what I find very popular is like ankles and head trauma stay with a lot of people, with most people. Anyway, put your hand on your forehead. Let's work through that. Just gonna get some air. Other hand off of your body. Doesn't matter which hand you touch. Yeah, push against my hand, push. So that's a bit yes. Let's go into the top of your head, please. Push. That's a big yes. Go in the back of the skull, please. Push. That's a big yes. Put it on the back of the neck, please. Push. That's a big yes as well. Right side of your skull, please. Push. That's a big yes as well. Left side of your skull. Push. A lot of head trauma, man. Go like this. Yeah, push. That's a no. Okay, take your hand away. We're just gonna clear the neck and head. Let's do this.
an incident. Do you want me to share something? An incident that I had go with my head?
You know what? Like, only if you want to share it. It's not necessary for me to know. Do you want to tell me?
Yeah, it was pretty.
Okay, tell me.
I had I ran under a tree and cut my
skull open
once. Yeah,
Uh-huh.
and I had stitches and stuff in there. But
Yeah, right.
I don't feel like it was super traumatizing.
Yeah. You know, head trauma is very, very interesting in that it doesn't have to take a lot to keep a head trauma. And like I said, not all people are the same. Actually, sometimes sensitive people can hold the memory because they're sensitive, you know. So if you feel like your body's quite adaptive and sensitive to like what your input you give it, it's not uncommon for you to hold memory quite well. Yeah. The more disconnected a person tends to be, there might be some sort of, I don't know, relationship there with memory, but I do find that people can be quite sensitive different. So put your hand on your forehead. So I'll just use your connection, because this is your wire basically. Because if we're just quantum energy, this is just a quantum wire that's now making a connection and a feedback loop. So right now you're processing that fight or flight syndrome just from the contact of whatever was at your forehead. And it could be, you know, birth trauma. Like birth trauma can be a big deal. Especially people that were born with, let's say, forceps or vacuum extractions. Massive, massive deal. Massive, because the head and skull can remember all that stuff. I've seen it so many times, and it was clear, you know, so many times where the person had no clear trauma to their skull, but then has a significant history of skull trauma from birth. So we'll just keep clearing that out. And so we're using the C1 and occiput, which is the skull and the first bone, just to reset the space. Let your jaw go. Cool. And then the back of the neck again. Good. Well, just have your hand on your forehead. I just want to retest that real quick. Push against my hand. Push. That's okay. That's done now. Just take your hand away. And so I'm just going to do I just want to see if we're proper, if things are working properly. Push against my hand. Push. Yeah. So still now. Push against my hand. Push. Something with the left knee. Push against my hand, push. Something with the left ankle. Let's just correct that. Yeah, what sometimes happens, and what has happened to Jordan, which I find fascinating, is that he's had some injuries that were significant for him. And the significance of those injuries, which were the surgery, but all the head trauma that even though he doesn't know where he got head trauma from, his body feels that they were significant. And what was happening there is, it was causing so much overload in your nervous system. I wasn't even getting clear tests out of this side. But now that that's over, it's very, very clear. It's quite common that the more baggage we remove from your nervous system, the clearer you become. This is sort of like your diet, isn't it, folks? Like when you start eating clean, you get all the sugar out, and then, so you don't have sugar for, let's say, 3 months, and then you decide to have a Coca-Cola. God forbid you have a Coca-Cola, but you think you're gonna have one of those, and the moment you sip it, you think to yourself, what am I doing? Because it's that much sugar. You're just so not used to it. You're so sensitive to it. So it's pretty common. All right, let's see how we're doing now. Push against my hand, push. Yeah, well, I'm pretty happy with that now. Okay, let's just one more time. Push, push, push. Let me see that.
Yeah, both.
Actually, I'm going to question that. Push against my hand, push. Yeah, no, I'm going to question that. Any broken bones? Never had a broken bone. No. You said something about your left shoulder, didn't you? You said something about your left side, left head. Yeah, something about that. Take your hand here. And just go over your shoulder. That's great. Push against my hand. Push. Just keep it there, please. So I'm just fishing now, really. That's what I'm doing. Exploring. I'm exploring the unknown. I don't know anything about your body, Jordan. I have no clue what's going on. I really don't know your history. And you're being forced to think about your history on the fly, which causes you to forget everything. Push against my hand, push. There's still some stuff in your shoulder. But you lift weights and stuff. Do you exercise? What kind of exercise do you do?
A mix of things. I don't really lift weights.
Okay.
Yeah.
Okay. Push against my hand, push. Take your hand away. Push. Yes, now that is definitive. Okay, flip around on your stomach, face down. We'll do the same thing, but now to your tailbone and your lower back. We'll move pretty quickly, okay?
Mm-hmm.
Hold your leg there. I'm going to push this direction. Push. Great. Push. That was the coccyx. We'll test the sacrum. Push. But actually, hold on 1 sec. Let's redo the coccyx one. Don't move. Push. Sacrum. Push. That's okay. Lower lumbar. Push. That's okay. Upper lumbar. Push. That's okay. Drop that down. Push against my hand. Push. Sacral. Coccyx. Push. Yeah, that's a big yes. There's something happening there. Coccyx and all that. Yeah, push. That one's okay. Sacrum's fine. Push. Lumbars are fine. Just gonna recheck the sacrum. Push. Yeah. Just gonna check Let's see. Push against my hand. Push. Okay. So actually, in actuality, both sides of the coccyx, the sacrotuberous ligament, which is a very, very deep ligament down at the tip of the coccyx, and it attaches to the inner structure of the ischial tuberosity down up on the inside. Both of them on both sides actually are not happy and in a bit of an injured state, but the rest of the sacrum is strong and powerful. And also this, which, you know, the coccyx then, when found by itself, it's not necessarily as a structural challenge. This one causes a lot of neurological issues. So it irritates organs, it'll irritate your spinal cord, it'll irritate your nervous system, but it may not fully throw your joints out of whack. So we're just going to reset the sacrotuberous ligament on both sides. Big breath for me, man. And relax your jaw. There we go. This side. The coccyx is a super important space. And we get to the end of your spinal cord and you have what's called the cauda equina, which is like, it's called the horse's tail. And the cauda equina is multi-strands, just like a horse's tail is. There's so many nerves like passing in and around the coccygeal area that coccyx traumas and misalignments and stresses can be responsible for the underlying cause of many disorders that people experience, or organ disorders, you know, unhappiness in their organ system, digestion, elimination, reproduction, you know, heaps and heaps of challenges. This one's quite reactive though, you can feel that on this side, way more reactive than the other side. There we go. Just recheck that for a second. Push against my hand, push, that's great. Push, that's great, okay, just relax. All right, well now that your nervous system is operating properly and is clear, we can actually see what's going on. So now, before it was an inch short on the left side, and I'm at now 2 inches short on the left side. It's significantly more. Turn your head to the right side. Turn your head to the left side. Face down straight. And so you might see me sort of make some movements with my hands, and it's because I'm just working with a different system of his body. I'm working within the core energetic structure of his body. There's, you know, multiple versions of Jordan hanging out here. Welcome to all versions of Jordan, by the way. You've got his physical body, his energy body, his spiritual body, and all kinds of his chemical body, which is interwoven into his physiology. There's all kinds of versions of him that are playing out. And I can utilize the different versions to provide me with different information. For example, the energy body can help me to see what challenges that are going on within the structure. Turn your head again to the right and turn left. And so while you turn your head back and forth, I'm just feeling what's going on face down straight. It's quite clear at the moment that he has some sort of not necessarily fixation and not necessarily a blockage, but an accumulation of stored energy that's occurring in his left SI joint. So his coccyx, his tailbone is the flat, and there's the triangle. And so when we look at his body, we can also see that his shorts are deviating off to one side. We can tell that the size of his glute on the right comparative to the size of the glute on the left is quite different. Now, it's not because the muscles have developed differently, although they may have. It's actually because his pelvis is rotated. So the entire portion of his pelvis here is rotated open. So we're seeing this whole flat surface, while this side is rotated in a different direction. It's changed it, and it's on an angle. This has moved the sacrum, and its coccyx is actually pointing off somewhere in this direction. This is probably like the crux of what you were talking about with the scoliosis, but it's happening foundationally here, straight from the tailbone.
Yeah.
Yeah, and there's a few ways that we can approach this. The first thing that we're going to do is we're going to look at one of your stronger muscles of movement. So turn onto your back, and we're going to check your iliopsoas. We'll look at the psoas because the psoas is at the core responsible for the stability and structure of your lumbar spine, as well as your pelvis. So you can have your arms over your head. So I'm just going to feel what's going on through the psoas. And so as before, which is not always the case, but as before, point both fingers towards me, all fingers, all of them. Yeah. He's got quite a bit of tension through this left side, where the right side comes up quite a bit, but the left side's resistant. Right side's a go, left side's a no. When we look at this angle of the rib cage, we can actually see it happening. The right side's a go, so it lifts, and the left side's a no, it doesn't lift. The shirt moves, but the angle down here doesn't change at all. It stays on that angle. So we need to get into your psoas, not because it's a problem, but because it's doing a job, and it needs help. It needs a little bit of love. So let's get in there and find out what's going on. Big breath in, then all the way out. Cool, just let it go. Good, so when you breathe in through the nose, and then breathe out quickly out the mouth. So in through the nose, good. And then go out, just out. Yeah, not too fast, just a little bit faster than dragging it out. And then out. Yeah, that's good, that gets me in there pretty quickly. I need to get a little bit deeper into the psoas. The first layer of tension deep in the psoas that you had, you integrated very quickly. You just released it. There's another core level of tension that's down inside the psoas. So we can catch that from this angle, looking this way. So the iliopsoas runs down from the diaphragm and comes all the way down, and it moves into the inside of both thighs. So there's one here and one here. And there's three different major parts to this one. There's a low part, there's a middle part, and an upper part. So you're holding in the middle part, maybe in the upper part. Could be in the lower part too, but I know for sure here, so we're gonna go into the psoas now. So that's the psoas there. You feel that contact? Now just take the breath in. Let your jaw relax. Let the lower lip come away from the upper lip. Yeah, that's it. Good. So we'll just get there again. There's another deep contact. So another nose breath in. And then just let it out the mouth. Good. Yeah. We'll just get into a deeper connection. Let the jaw go. That's it. It's a little stubborn. It's been like that for a while. And so your psoas has been stuck in this state for a long time. Doing its job by the feel of it, because it's quite healthy overall. A little stringing in the lower division of the iliopsoas, so the tissue itself has got like some stringiness to it. You feel the stringiness to that psoas in there, yeah? Jaw, thank you. We're getting down into the connection of the iliopsoas along with a muscle called the iliacus. Yeah, you feel that in your jaw, like it's moving through? Yeah. Once we get deep into your pelvis, it is coming through the jaw space because of its integration with sacrum. Jordan, you're moving quick. There you go, buddy. Here we go. Let's get your jaw to release a little bit more, and I'll come into that interaction of the iliacus with the psoas. So I'm pushing inside the pelvis to release this down. And we can see that contact deep inside the pelvis here. That's it. Let the leg go a little straighter. Straighten it more. That's it. There it goes. Good. Just windshield wiper this left foot back and forth. No, keep it straight. And then windshield wiper it this way. No, the whole like this rotation. Yeah, that's it. Back and forth. Just focus on the foot moving. That'll help you get the rest of the day. So what's really interesting is that the experiment or the exploration with Jordan is one of optimal function. He doesn't really come in here looking for, please fix me my particular problem on my left toe, right? He's not here for a specific thing like that. His is more open-ended. When it's open-ended, I can actually take the prompts of the body and work with them quite well, because he's guiding me down the left leg at the moment. The tissue has got a pattern, and the pattern's passing through the inguinal ligament, and it's rolling down into the inside of the leg. So what we'll do is we'll take advantage of that particular activity, and we'll actually follow it. So what I need you to do is I need you to roll onto your left shoulder, so you're on your side. This leg comes up. Good. Which I want you to do, which, hey, can I just say to everybody, we're all just humans, right? And us human people have bits and pieces and parts. So I'm going to ask Jordan if he can reach down with his left hand and pull the boys up out of the way. So cup the boys and pull them up and hold them there. Now the reason why I'm going to ask him that is because I'm about to get into his adductors, okay? And the adductors will connect right up at the groin. So we need to start easy. So if you can come back here and just get that from this back space. I'm going to grab a towel, only because you're wearing shorts, and I don't want to pinch your skin, because we're going to get right on it. Here we are. So we'll start with that connection there. We'll just start with that. See where it takes us. Looks like it's a bit more, you got forward and back. Let's go to here. And we're into what's called the adductor magnus at the moment. It's a fun muscle to have worked on. There's a bit of not a blockage, but there's a congestion. Okay, go through here. There we go, okay. Come back into this hamstring because I noticed some stringiness, quite a bit of stringiness through the hamstring. And your hamstrings, there's such a huge muscle group, the hamstrings and the quadricep, because of the twist in your pelvis, you're going to have all kinds of functional, not disorders, but functional patterns. You're going to have all kinds of functional patterns, because you had mentioned to me about functional patterns, didn't you? See, your functional patterns are patterns that function in a dysfunctional system. And that's the thing. How do you get to the system to be more functional so the dysfunctional patterns become more functional? The question then becomes, what's important? Is it the functional pattern or is it the system? Good. Allow this to discharge out through the sole of the foot. There you go. That's what we're talking about. Good. There are subtleties going on within the context of what Jordan is experiencing. So he's got an accumulation of energy now, and these energy stores need a pathway to transpire, right? Just guiding him out so that he focuses in on the sole of the foot, releasing tension at the back of the knee, the calf, the heel, the Achilles tendon. There we go. So lots happening inside your hamstring. I was going in for the adductors because of the connection of the iliopsoas, but it seems like that pattern was quickly moved into your hamstring group. Lots of discharge happening through this leg. So what I mean by discharge is tension in the muscle or tone or hypertonicity. That's just an accumulation of energy. Electricity. So when you then release it, you're discharging it, right? Just like a battery or a capacitor or something like that. And in discharging the energy can not be created nor destroyed. That's the universal law, isn't it? Energy cannot be created nor destroyed. Energy is just energy. And in this energy field, when you see the discharge happening, when the discharge is moving through the body, it's there. I'm not giving it to him. I'm not taking it away. I'm not breaking it away. I'm not getting rid of it, and so it's gone forever. You're just transposing it, yeah? And when you transpose the energy then expands and becomes something a bit bigger and better. When it's trapped in the system, it becomes the story. Energy in the system is the story. When energy is repressed and stays in the system, he stays with his story. When his energy changes and the energy starts to lift and you let it and release it, the story no longer is the story anymore and you transform. The story could be whatever. At the moment, my gut instinct here is that it's just a story of patterning from his pelvis and sacrum. Lots of other cool stuff going on. Jordan, you mind if I ask you a question, a personal question? Have you done psychedelics?
Yeah.
What psychedelics have you done?
Some mushrooms and stuff.
The mushrooms and LSD. Guided or party atmosphere?
Guided.
Okay. So, for those watching and you see Jordan moving and you hear him breathing and you think, wow, is it that painful or does it feel good or like what's the story? All I can share with you is that there's a tendency in the use of psychedelic medicines. There's a tendency to create a tremendous amount of openness in the body to but to reintegrate thoughts and processes. And when someone generally goes through that, now I'm not talking about the party atmosphere, I'm talking about specific scene setting guided by people who know more than you about using those medicines. And I'm not saying as a doctor, I'm not turning around saying you should all do it. It's against the law. Yeah, it's against the law, right? Naughty! Don't do that. Okay, but given that, and that he did whatever he did, there we go. There we go. Right through the foot. Nice. That's what we're talking about. Finish it. The process of that has opened him, and so what he's experiencing is the nature of energy moving through his body. Now, there's a last discharge occurring here in the center of the foot, right at the sole. Yeah. And we're going to use just some tissue work because, there's issues in the tissues, right? And then that's going to move it through the foot. There it goes. Feet are so important. There it is. Here we go. Here. That's it. Cool. Let me just see where we're at with this. I like that. Go on your back. Face up. And your arms over your head. Yeah. Okay. It's like, is it even attached anymore? It's like one of them wobble heads that you find on your dashboard. I know. The right one's moving quite well too, but the right one, I'm just going to come in and touch base. I'm just going to touch base with the right one. I want to find out what the atmosphere is like in here. Now, I'm not getting feedback that says, hey, I've got a problem. I'm getting integrating feedback here so that its state is changing. So in Jordan's body, the left iliopsoas or the left hip flexor was the one that sort of stuck or fixated in a pattern of dysfunction. The right iliopsoas, it doesn't seem like it was stuck so much in a pattern of dysfunction, but it's more adaptative, so it's been adapting. That's probably why you've been doing fairly well dealing with whatever you deal with. And even the iliacus on this side, patterning is well adapted. Let's cruise through the inner line on that leg too. Can you lay on your side facing the windows? Bend this knee. Just focusing there. It's going to take this down so it doesn't interfere with what's going on in the room. Okay, reach down, grab the boys, get them out of the way so I don't run into any obstacles.
Left to right.
Just doesn't matter, whatever you're comfortable with.
I'd also love to add that I've done like a lot of exploration and meditation and breathwork, so I feel like...
Yeah, sweet. You're entering those states already.
Yeah.
Which is a great point, by the way, because...
It's not just the medicine.
Yeah, holotropic breath work and the preparation. What's really interesting that I find the most fascinating is that people think that the medicine is the solution. But the medicine is not the solution. The critical ingredient that has been missed in psychedelics is the preparation leading to the medicine. It's what you did to get to where you want to go. And if you're going to use, it's sort of like, if there's a speedboat, you want to try to get your speedboat license before you jump on the speedboat and drive it across to get to the other island. Definitely. Right? Not everyone does that. The party people, the people who just don't really understand the process, just jump in the friggin' speedboat and they start driving, Sometimes they crash. It's not good. You've got to actually prepare. When you look at some of the programs like MAPS, that they're putting themselves on the map to try to help create these programs. This one too, hamstring's quite tight. This hamstring on this side.
They use the hamstring behind my knee to.
This one's not heavy at all.
Yeah.
This one's totally locked off.
Yeah.
You're gonna have very little access to it right now.
Yeah.
So they use the hamstring tendon
to build the ACL.
Yes. Yeah, your hamstring is non-responsive at the moment, which is okay. We're just gonna wait. And it'll respond. If it doesn't respond, we're just gonna get out a bigger hammer. Just kidding. Okay. Still playing with access into the hamstring. It's still not doing what it needs to be doing. It's still not. But that's just time. We just need to wait a little longer and find our right space. There we go. There we go. There we go. Jaw. Jaw, just relax your jaw, yeah. And just an easy breath through the mouth, in the mouth and out the mouth. Try it out. That's a better breath. Yeah, stay with that breath for now. Nice and easy. Don't overdo it. You need to stay in that zone there, and the breath will take you too high out. So we use different breathing patterns, okay? So there's different breathing patterns. Some breathing patterns do one thing, and other breathing patterns do another thing. In this particular instance, I have Jordan breathing in the mouth and out the mouth, and it creates a different pattern of sensation through his physiology. So everything from the muscles that he uses to create that breath pattern to how much oxygen he pulls in and how he pulls it in changes. So if you breathe through your nose and out your mouth, that's different than in your mouth and out your mouth. And there's a lot of controversy. Is it better to breathe in the nose or is it better to breathe in and out of the mouth? Well, I think it's clear, like people say, it's better to in and out the nose. But the truth is that all breath patterns have purpose. So what breath pattern do you want to purposely use to work your entire afternoon, to be in your afternoon? And why the nose breath, in the nose, out the nose, is very popular, because it's a very calming breath. So it can relax you. We're nearly there. We're getting to the point now in the hamstring where the thing happened, whatever that thing is. Here we go. Just in that space there. There you go, brother. That's it. Stay open to that. Yeah. Just through the... So we're just getting to the part of the tendon where likely that was actually used in his surgery. And when we got to that part of the tendon, it was completely not energized at all. Very low functional state, stuck functional state. There we are. I mean, was the muscle working? The answer is yes, but its default position was not exactly in the best space. There we go. Now the hamstring's just releasing. Bring the hip back. That's it, just like that. That's it. But now the hamstring's actually coming back to life again. I've got some softness back into the belly of it. Relax your jaw, and now you're discharging out the sole of the foot. Yeah. There you are. There you go. Right there. Good. That's free. We'll go here now. That's special. Yeah, that's a good word to describe a special feeling right there. Now I'm in the calf muscle, and the calf muscle is a different tissue than the hamstring is. It is made out of different cells, and how it responds to the world is different. So when you get into the calf, your friend is time combined with pressure. Your foe is aggressive movement. You just want to sort of hang in the calf muscle, not too aggressively, and then wait for the transformation to come. Wait for the information to flow. Here we go. This one's a bit different too. This ankle's got Achilles tendon challenges from the hamstring being so bound up. So I'm just, the gastroc, the calf muscle, let me move this, I'm good now. The calf muscle comes down into a tendon and then eventually into the Achilles tendon. So it's a big muscle that gets smaller and smaller and more dense and more dense. And in the fascia of it, there's a challenge just at the base fascia as you come across the tendon. It's just not fully releasing, but it's starting to integrate now. It's in the muscle tendon junction. Yeah, and where that junction occurs is roughly around here. And and then that integration. There's some stuckedness in there. Yeah, I need to unstick your stuckedness. There we go. And that's centered muscle tendon junction right through the core, which is discharging down the tendon at the moment, and then the tendon comes across the heel like a spider web, which hangs onto the heel. So he's discharging into the deep calcaneus. This foot needs to be adjusted. The calcaneus is out of alignment, and some of the other inner bones are out of alignment. Here we go. That's it. We need to move straight to the adjustment. You can go straight onto your back. I haven't really adjusted you yet. This will be your first one. We're starting with a heel adjustment. That's very interesting. Okay, just relax your jaw, please. Ah, how interesting. So it wasn't really your calcaneus as much as it looks like it's your tibia fibia. Yeah. Okay. Feet are interesting and amazing. Because we're here in the foot now, and we've been taken through this pattern from your pelvis, I'm just going to continue fixing this pattern from the knee because it's quite isolated due to the injury that you had. Some part of it being hit, and then some part of it. So when you had that ski accident, let me ask you a question. How did you hurt the leg? Did you fall on it? Were you taken out? The knee, what happened to it?
I came off a jump, landed, and my legs came beneath me, so it twisted.
Oh, so it was a twisting injury.
Twisted under me.
Oh, okay, yeah. Because that's interesting because
under, beneath, and behind.
That's why we had to dig inside your joint to clear the injury out of your knee. Do you see that? Is because the injury didn't occur to the structure. The only outer structure that was actually hurt was these incision points. So it was inner structure.
Because I also landed on it, there was some.
And you had the impact.
Yeah.
Well, that's deep internal joint. That's why we had to go in here to clear the tension out. Yeah. It's also one of the reasons why I see there's a lot of, you're stuck in rotation. So this has to rotate both directions. It has to go back and forth like that, right? And then you have that. So you have this and you have that happening, right? And your rotation there is quite nice. So where is that going to be? Let me see the other one. So your issue is not in the rotation. Your issue is in the tibia and the femur. So your fibia and your tibia, that's where it is, in between these two. Because of the twist, and you had this operation which repaired the knee, you still are holding significant tissue tension between these two bones, the small skinny one, fibia, and tibia, yeah? So you're still holding quite a bit in there. So let's free that up. Maybe we'll get an adjustment out of it, maybe not. Just letting your jaw go again. Let's tuck your chin length from the base of your skull. Good. See if you can keep the back of the skull open now so we can get you a better integration of the spine because we'll be moving on in a minute. As soon as I'm done clearing this. So this injury is, 2.5 years old, and he's been walking on it. Or how are your injuries at, 20-year-old injuries that you've been walking on? So we're just peeling apart the fascia that's holding in between the two structures, between the big bone and the little bone. We'll just call them the big bone and the little bone for now. And then just seeing, okay, so that freed that up quite a bit, but this bone right here has been jammed up into this area. But you said they did a ligament repair on the outside, didn't they?
No, it's just the ACL inside, and then they inserted a synthetic between the two bones.
Yeah, between
stapled on
between these two.
Scar and scar.
So, okay, so that's what I'm feeling here.
Yeah.
The tibia the fibia is actually being pulled towards that area, and it's jammed up higher. Yeah. See, now because of your functional change, right? You don't follow the normal rules of how a knee should follow anymore. You don't have that. It's actually been pulled up now which then throws off your foot and ankle, which then creates a pattern change in your body, which then might have gotten you to the point where you're at with your pelvis, or may not have, because we don't know.
Yeah. The ankle happened before the knee, interestingly.
Yes. Yeah, okay. Let's see. Okay, so I'm pretty happy with the movement now between the two, like there's glide, and there has to be glide, so we're gonna leave that. Let's recheck what I did in your belly, and then see where we're gonna go from here. You see your arms? Yeah, so I'm really happy with the connection that I have here. That's great. That's good. All right, turn around, face down. All right. Turn your head to the right. So we're still short leg on the left, quite a bit. Turn your head to the left. Now, I don't have any reactions from you turning your head face down. I have a change in the pelvis though, and I also have some really interesting change happening through the other side. So what we're going to do is I'm going to decompress this side for you. You just follow the breath I ask you to do and where I ask you to focus and what I ask you to do, okay?
Yeah.
Great. So we're just going to get into the fascia of the sacrum on the left SI joint. And we're just going to hold that point there and just breathe. Now I want you, Jordan, I want you to focus on the inside pelvis, between this bone down here and the other side. I want you to just breathe into that and relax the groin into the table pads. Yeah, like you're melting your pelvis into the padding of the table. Another breath there for me, my friend, another breath. Now this passes through the deep groin, so through the area of lower pelvis, then going into the inner part of the leg. So on the exhale, go through the inner part, go through the groin, and relax the inside line of both legs. Good. How about the front thighs? Can you let them go a little bit? There you go. Back into the groin again. There you go. Back into the inner legs. There you go. Down into the knees now. Kneecaps. Good. Yeah, just work on the kneecaps for a second. Just breathing into them. Into your shin bones. Okay, good. Ankles. Relax your jaw. Big breath in now. You need a little energy. Inner energy. Tuck the chin, lengthen the neck. Big exhale. Good. Stay with me. So we're just going to move in through the tailbone here. Oh, and see all the pieces of the puzzle, they start to make sense with the tailbone injury that you've had, the way that your sacrum is, why the sacrum's that way, why it was twisted. You know, all the pieces of the puzzle make a little bit more sense as we work along. In the beginning, we know nothing. We just take information down. This is right at the tailbone, okay? Right through the base of the pelvis, perineum. Yep, and it takes you straight in through to the belly button. So all that breath work through the center core of the pelvis as I move through the coccyx. Good, there we go. That's it. And then through the attachment of the hamstring, ischial tuberosity on the left. Just let me work that for you. That's it. Wait, wait, wait. Okay, good. And then just through the hamstring, back of the knee, all the way out the Achilles tendon. There you go, buddy. That's it. Good work. Good release. Here it is. Gotcha right away. There it goes. Okay, so now there's less pressure in your left SI joint. It's willing to do something, and the leg lengths have shifted by quite a lot. So we're down to a half-inch difference maybe between the left and the right side. And yeah, this is good. This is good progress. There's a few other things that we can see happening here, or at least I can see happening here, I guess because I've just been here doing this for a while. One of the things is that his stabilizer and the glute minimus and the glute medius, these are important stabilizers and functioning muscles of the lower pelvis, and they have a lot to do with posture. They're just, I don't know, how do I explain? They've been kind of overworked a little bit and underappreciated. Overworked and underappreciated. So what we're going to do is we're going to flood them alive with information, and we're going to flood them alive with blood. You're gonna feel what it feels like to do that with a muscle that's been in the state that it is, and that feeling, you have to just allow that through your body, and whatever happens, like however you feel, laughter, whatever, it doesn't make a difference. Yeah. All right, so we're just gonna work through this. Okay, here we are. There we go. That's it. There's your breath. Gotcha. So it's a little bit like this feels amazing. Big breath. Let it go all the way through you, through the leg. Ooh, come on. Come on. You can do it, brother. You can do it. Come on. Come on. Come on. Come on. Come on. Come on. Through the air. Line. Come on. There you go. Come on. There it is. Come on. Come on. Now it's a big, long problem. Been there for a long time. Bend this knee. Good. Now circle your foot around. Big circles. Big circles. That's it. Keep going. There you are. Gotcha. That's it, right there. I know what it feels like. Yeah, through the neck. Good work. Yeah, there you go. There you go. There you go. There you go. There it is. Got it. Nice work. Here it is. Last bit through the glute medius. There it is. There we go. Okay, so we're actually now changing the shape of his pelvis. So the shape is starting to change because the muscles functions changed. This hip is now dropped down out, and this one's all, tensed up still and brought up. And we need to do the similar thing for this side, even though the environment is slightly different. So just a slightly different pattern maybe, I think. We'll find out once we're in. Good. This is a scary one.
Right.
Yeah, it's all good, bro. It's all good. It's living in there now. What you don't express, you repress. Just to be clear too, we're not like getting evil things out. This is not what this is about. This is not like excising the demons, although I like to sometimes feel like then talk about it like that. This is integrating what you already have, the stored energy, your stored potential. It's integrating your stored potential into the new version of who you're about to become. You're upgrading your system. You're moving into another version of you, and this is the liberated version. When you combine the upgrade, okay, with you moving through the system of life and moving into this next reiteration of yourself, if you embrace it, you do so both through your mind, your physiology, your breath. You add motion to it, to it, emotion. You feel it through the body. You feel it viscerally. That's it. There it is. This is it. So when you went to that level there, do you just see what happened there? Do you feel how that just went and changed? Like, I don't know where you are, brother, but you realize that wherever you went to just then just changed the entire structure. Your whole hip just released. It's not even the same hip anymore. There you go. That's it. Yeah. You can see as he's breathing, there's a wave moving now through his body. And it just floats through the system. See, his generator at the moment down here, for this wave that's happening here, you can see it kind of happening. This is not happening here. But then it happens here, and it moves through the body, and it eventuates to the head. This is a natural rhythmic wave of the body that everybody has happening, but it's not happening here because there's trauma, because there's a story, because there's a pattern, there's a desire, something's happening. Liberating this opens his whole energy system up. He will become a different version of self. So I can do this a couple of different ways, but in this particular instance, we're going to move him along quickly. I kind of like the fast route. I don't know if I can take the quick route. If I want to go for the path of least resistance, I'll go this direction. So just with my general checks, we have what's called the posterior inferior pelvis on the left side. So I'll get you to lay with your left side up facing the windows. Facing this way. That's it. So we'll just adjust your sacrum here, there. Good. Relax your jaw. Good. I got you. There it is. Well, that's your first official chiropractic adjustment of the spine. Okay, there you go, face down. That's it. Just breathe into the body. Okay, breathe into your body. Let that free up a little bit more. Let your body integrate that a little bit more. Okay. Well, that's rapidly changing. What's occurred now is got a good flow coming up through the left side. And this entire quadratus lumborum area, this whole kidney area is releasing out long, and the left leg is able to flow through the left channel. And you can see that we have a considerable torque through this right side, and his body's kind of like caving into this space, and he has a huge lean still in one direction. This ilium is really rotated. This ilium is rotated up underneath his body, twisted underneath him. And understand that this is the leg that you landed on, that you twisted. So your femur is literally rotated internally into your groin, and you've twisted the entire thing, and all the way from the sacrum down. I mean, it makes total sense when you look at the method and mode of injury and what we're seeing here. Why are we seeing such rotation? It's not necessarily a normal pattern in the Western world. This is brought on by something special. I'm just doing some what we call challenges to the system, just to see what it is that it wants. I decided to work within the physical system to get those challenges. There's many ways to work in the physical system to challenge the human body. And just this is one particular method that I find fast and can do it quite easily. Okay, lay with this side up, face me in this direction now. So here's what's really cool. You're just gonna lay there. Check this out. Here's Bob. Now Bob's, actually I'll bring him over to you so you can see. Now Bob's sacrum, okay? This bone here was twisted significantly in this direction. This bone here didn't just stay where it was, it actually has dropped forward on this side into the pelvis. And this one, actually, this one's rotated because this is popped up. This one has rotated this way forward. And because this bone has done this. So this is pulled out like that. Yeah, so we need to unwind you now. Okay, Bob, I'm just gonna retire you to the side. Let's unwind your sacrum. Because the sacrum is where the issue is, down here in the center of your body, on the left side. So even though I'm adjusting you on your right side, I'm adjusting your left SI joint. That's what I want to move. Relax your jaw, tuck the chin just a little bit in, bring the belly button in from the inside. Oh yeah, this is fabulous. Amazing. Let it go now. Watch. Come on, let it go. Oh, look at you, face down. There is so much more to this, I'm excited. Face down. So here's the deal. You get surprised, I have it. It can move, but it won't. Why? Why won't it move? Because there's something else that comes before it. There's something else happening in the body. Now I can just choose to say it's not moving today, or I can choose to say, okay, well, let's find out what's causing it to not move today. Turn your head to the right side. Get back to center. Turn your head to the left side. Turn back to the right side again. Yes. So when he turns to the right side, his heel lengths subtly change. Turn back to center. See, it's very subtle though. I don't know if you can tell. You ready? Back to the right side. Watch him shift. See the right leg pull up, and then they come back good again. Watch it go down again. Let it settle, and then everyone watch this leg. Watch this leg change. Okay, then turn. Watch the right leg come up and settle in. Okay, let's do something else then. We're gonna get into your cervicals. Now he had something with his shoulder. He's got a big reaction here in his neck. What's with the shoulder there? I see something with your shoulder. That's right. You don't know what it is, but there was an injury there. Something happened. Okay, let's work on that. great. Hang in there.
I wonder if I had an accident where I got washed up on some rocks and my shoulders, my elbows are hit, and I wonder if I radiated up.
Something happens to you.
Yeah.
Now, it doesn't have to be a trauma. It could just be a pattern that you're running because of your, the other thing that we're working on.
Yeah.
Or something else that's randomly happening. Like at any given moment, you could have hundreds of things going on with your system.
For sure.
Although seemingly independent, somewhere deep inside, fully integrated. You get that? Let this hang. So we're just gonna So this is really interesting because there is stuff going on with his shoulder. It's coming into his neck. It's overriding the sacral adjustment. It won't let the sacrum adjust. We'll find out later why. It may not even be there. We say sometimes we know what's happening, but as we get deeper and peel other layers open, we are quite surprised. I'm often not correct in my first idea. So here's his infraspinatus, and it's quite inflamed. Like it's really tender. So we're gonna wake this one up a little bit too, but in a different way. And I'm gonna walk you through just getting it out through the arm. Okay, let's do this like this. A little higher. You gotta have tables that go up and down to save the doctor's spine. There we go. Relax your jaw. So I want you to think about this as like an ice cube, and when you breathe into it, I want you to just warm it up, and as you exhale, I want you to just allow it to melt into water. Let it come through your shoulder. Allow it to run down into the arm. Feel the elbow. Allow it to come down into the forearm. Open up the wrist, relax the palm, relax the fingers, and then out. That's it. Relax the tips, webs. There you go. Good. Now just keep that line open, and then work with what you're feeling here. Breathe in, melt it out, more water flowing through the system. Keep the system open, all the way through the finger webs. Cool. Good. Good. Jordan's doing a great job of just calmly dealing with the sensations here, because I can assure you that they're not the most pleasant sensations working through the tissue the way it feels now. Especially, it's just quite dysfunctional. Let's change positions. I'm going to get underneath this now, so we're just stuck here. Here we go. Oh yeah. This is a big deal. Relax your jaw. There it goes. What are you going to do with this new body, Jordan? Yeah, man.
Change the world.
There you go. He says, change the world. That's my definite purpose, folks. Not to change the world, but to do great things for people so they too can do great things. Maybe it's up to him to change the world. Maybe we all change the world and we have our own unique approach to it. Your first challenge, I think, with that is just realizing that you are a part of that can change the world in whatever way, even if it's your own inner world. So we've moved what was stuck inside the armpit. And we've moved it, and now it's passing through his deltoid. Passing through the deltoid, moving into the elbow, bicep. And we'll continue allowing this process to decompress and unwind. Look, his arm was twisted. And this, whatever twist occurred, the remnants of the twist is still in the tissues. Even though the tissues are healed. It's sort of like when you wear tight socks and you take your socks off and you still have a ring around your ankle for 3 hours. It's the same, except deeper, much deeper. You gotta relax the wrist. Now the fingers. There it is. That's it. That's it. Big breath. Again, wrist, fingers. There it goes. That's it. There it goes. I got you. Now we got it on the run. Here we go. Oh, here. Oh, still further. Okay, here we go. So, at the moment, way energy works in the body is that your joints, and this is just for you folks that are into like electronics, your joints are like capacitors. They like to hold energy, and they won't necessarily easily release energy. Well, they will, but when energy comes in, they release energy out. That's how the joints work. Muscles work different. Muscles are like batteries. They're constantly getting charged. So his elbow joint's holding a bit, and so is his wrist joint. So it's like traffic is trying to get through, but there's some detours and blockages going on, and there's some blockages. Instead of 5 highways, maybe there's only 2.5 highways moving through his hand. And because of the nature of the forearm bones are already twisted one on the other. This injury that he had is a twisted injury. You can see the twist because what it takes to get rid of the injury, what it takes to unwind the pattern. There it is. Got you now. These were all those years of doing Chinese Qinna, or martial arts, comes into play. Because this, as weird as it sounds or weird as it looks, probably feels amazing inside of the forearm and wrist as it's getting stretched, right? Yeah, it's not even painful. You don't need things to be painful all the time. Sometimes you just need things to be.
That's smiling.
Yeah. Yeah, because your wrist is about to release.
Yeah.
And that's obviously feeling that culmination coming up into the wrist joint. Yes?
Yes.
Yeah. There it goes. There you go. Oof. So when we pull on the fingers, we can actually use the entire finger fascia to get into the wrist bone. So I'm actually holding his wrist bone, the bones in his wrist, to feel the bones in the wrist move when I pull the fingers. So it's not just about cracking fingers, you know, it's much deeper and more functional than that. You still have pattern for your chest. That's where we're at. You gotta go on your back, please. And the continuation of this exploration is that we're exploring a new pattern now through his chest. Let's see if we're on time. We're not great on time. Let's move through this upper pattern. This will be taking us into his neck and likely will take us back to his pelvis and kind of finish him for the day, because he's the kind of guy who keeps going. Just his body's quite responsive and adaptative. So we're just going to peel through this layer of not good enough or whatever that is happening in here. I'm just going to get through that. There we go. That's it. So he's just holding trapped space in his sternum and just now showing that through the throat. There you go. Hang on a second. I'll get you there. Just open it up this way. That's it. Stay with it. There you go. Let your jaw go. Yes. Go in. Yeah. Try the mouth breath. Out. So mouth breath in here. No. Lip it. You gotta get the lips out of the way. It's an open throat like this. Like that. Go. Yes, that's it. That's better. There you go. Good out. Go out again. Good. Another one of them right from here. That's it. There you go. A little bit less tongue in the back. You've got to let the throat completely open. Let the throat open. Yeah, jaws relaxed. Keep the arms open like this. And keep the fingers integrated here. So you can open them wide. I need you to turn them on. Turn them on. He's on planet Z already. Just turn them on. Yeah. Keep going. Turn them on. Yeah, that's it. So let the finger webs turn on now. Feel the finger webs. You've got to complete what's happening through your chest. That's it. That's it. That's it. That's it. Yeah, work it through the shoulders. You feel it coming through the upper part of your back? I want you to work with it through the upper part of your back, yeah? Tuck the chin, lengthen the neck and out. Bring the chin down and in this way. This way, yeah, yeah. Work it through the upper back where you feel it there. Up in here. Yeah, yeah. Keep going. This way. Yeah. Yeah, I got you. I'll get you. Here you go. You ready? Here, just this way. That's it. Good. Wait. Stay here. Stay here. Stay there. I'm nearly there. There. You don't know what to do, do you? Here we go. Okay, we'll do a mix of the both. Good. I'll just keep moving it with you through your body, and you just keep responding to what it does as it moves through your body. Stretch your right arm a bit more. Yeah, that's it. That's it. So we're just moving through the tissues, allowing him to move as I move him through the tissues. Because there's like so many different ways to do this. You could like try to get a massage done to yourself, jaw, throat, right? Massage done to yourself, or you can move your body and try to do it yourself, like yoga, or you can kind of do both. Right arm reach, 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 right arm reach. Keep going, keep reaching. Keep going, that's it. Big breath here. There it goes. Here, there. Through the chest. That's it. That's it. Move it through the neck. Here. I'm going to help you with the neck one. I know where you feel it. I got it. Yeah, I got you. Just move this arm. Yeah. Yeah, I got it. I feel it too. There it is. Yeah. Hang on to it. Feel it through the upper back. There it is. Get a close-up one on this. Come close at the neck. Yeah. All this is going to move through. Yeah. There it is. There we go. And then through one more time. That's it. Here. Let it go.
Magic.
That's what we're talking about. That was pretty great.
That's so good.
Yeah, that was great. That was great. New neck, new shoulders, new something. Turn on your stomach face down. Let's tie things together. So where did we leave off? We left off with a left short leg. We are now right short by a lot. It's okay. Things that this is not us going according to plan. This is just things going, okay? Yeah. So what this means is, it means that all the stuff that we saw with your pelvis before was mostly being caused at the second round when I tried to adjust the other side. A lot about what was happening through your neck and the upper back. Now we'll come in here, and this is completely different. And it's actually opposite. Exactly opposite of what I thought. 100% opposite. Wrong direction, wrong everything. We'll put this side back up. Face this side on your shoulder, lay on your left shoulder. So I'm going to do an open leg adjustment here. So just let me have your leg. Good, I got you. I'm just going to move your body. And then relax there. Good. And bring your head back into space here. There. Yeah, this might be too much. Hang on. Let's find out where we're at. Yeah, just chill there. Just. No. Just got to keep changing the position until I sort it. Because there's more going on here that meets the eye. Once I'm in here, I hate actually videoing this process a little bit because you don't realize how many times you're going through a treatment with somebody and you think it's one thing and it turns into something else. Like it's constantly happening, yes?
Yeah.
And it's kind of morphed again. It's not what I thought it is, and it needs more help. So we'll do this and get that final change to happen, okay? Yeah. Jaw relax. As I'm decompressing his ligaments and tendons here in the glute, you come in close and you can watch what's happening with the elbow. I'm just holding space on his structure, and I'm waiting for his structure to give permission for me to move forward. And I'm working into the fascia system. The fascia system is a very interesting system. Communication, light communication, structure, function. Big breath here. So we're about to come across the greater trochanter. Exhale out. There we go. And I just get permission to start going across the greater trochanter. Another breath. And out. You know, I shouldn't be surprised on how complex this is, Jordan. Just, you know, the injury that you had is significant, not insignificant. Although, talking to you, you don't make a big deal out of it. But it is a big deal. The amount of twist that went through, it didn't just stop at your knee. It actually went right up into your sacrum, and that's what we're dealing with now. We're dealing with a deep foundational twist from this injury that moves up into the front portion of the sacrum. It's not as simple as a chiropractic adjustment. Oh, there, just got an adjustment for your sacrum. The sacrum just went clunk. There we go. So as I'm releasing the tissue, the sacrum is going to be changing space. You can actually see it move if you pay attention. Watch the sacrum move. It's pretty amazing how it's moving as he's breathing. Before it wasn't moving at all. There it goes. We're going to get some more switches here as well. There it is. Come on. Just got to release this through the seat. It's not easy. It's pretty tense here. Almost there. Through the back of the hamstring. See, this even goes down to the back of the hamstring. It's another deep pattern located deep underneath the first initial one. Come on, come on, come on, come on, come on, come on, come on. Nearly. Nearly, 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 nearly. Oof, there it is. There it is. There you go. There it goes. Crunch, crunch. Crunch, 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 crunch. Good. Oh, that's the one. Oh, that's it. Right there. Good one. Good one. Mm-hmm. Finish it. Finish it. Jaw. That's it. Okay. Face down. We need to pull that up and out now. Yeah. You can get close on this. This is always fun to watch. Crackety crack, crack, crack. There we go. Wow. Out. Okay. I wonder what we have on store. Well, looks like his left leg, right leg are very happy together. It looks like his sacrum is back in its position. I like the sacral movement. Really good. Should probably try to adjust that hip, and then we'll set you free. Turn on your back. I just let it drop. Yeah. Relax your in the glute, in the groin. Yeah. This one's jealous now, isn't it?
Yeah.
Yeah. That one, much different. Yeah, you still hold a little bit this side. Feel the tension that you're still holding deep on this one, and then compare it to that with how that's different. Here's the mount that it'll roll in. Another job for another day, my friend.
Of course.
Well done, brother. Good. Thanks everyone for watching. Say goodbye to Jordan.
Thank you, thank you.
Now we get through the adjustment, and you know what was really interesting, because I didn't know where the adjustment's going to go, and I'm just thinking that you were chasing something more mystical, and what we really wound up was very raw structural work. I mean, we've used many techniques to get through to it, but raw structure work. So what has occurred is that you've landed on your right leg, which you've told me, but it's actually, you can see it in the tissue, written into the tissue of your leg. You have a twist through the entire tibia fibia that came all the way up through the knee. The knee was clear because the guys did the work on it, but they didn't really work top and bottom, which then left you with a hamstring that was kind of traumatized, and it was stuck in contraction, so it wasn't as fully released as it could be. You're just lucky you're flexible, because the other parts of your hamstring were releasing and the stuck ones weren't. So then it comes into the hamstring, but because of the hamstring the way it is, your pelvis, because you're flexible, actually twists and twerks because it's been pulled into a new position. And so then you adapt with that new position, which then puts stress on your sacrum, which then changes your neck, and then potentially that left shoulder, that was a different injury dealing with the neck. So you're maybe dealing with two different issues that were sort of collaboratively coming together to create, you know, a non-functional version of yourself, right? Because the left shoulder was great treatment. Like, you had a lot happening within the tissue and the underneath structural muscles. They weren't activated, they weren't integrated. Same thing with the glute minimus and glute medius on both sides of your pelvis. They weren't activated, they weren't integrated. So the portion of just getting that back on board, that could have been shut down because of injury, that could have been shut down because of lack of use after an injury, pattern changes. Like, there's all reasons why they turn off and then they don't necessarily come back on. Yes, they're active, yes, you can measure them, yes, there's tone to them, yes, but you functionally turning it back on is different than you just feeling energy in it, yeah? Yeah, your neck, that was cool. Your neck, and did you felt it move all the way into the lower part of your neck where then the sections separated apart? That was great. Oh, it was amazing. Yeah, really good release through there. And you'll still have some challenges across the chest. There's still going to be patterning going on because you still have adaptative patterns happening there. We don't even know if that's like fully going to be changed. We don't have no idea. I can tell you for sure you're holding in the left one, and it'll be opposite likely of what was happening in that right one that we've cleared. So we just need another touch base again. Yeah, and we'll schedule another session and we'll get you moving along the line to feeling amazing. Okay. Well, you are seeking knowledge. You're seeking experiences. You're seeking. There must be a higher reason, a higher purpose, and you're working through your physiology, which is important. And it's so funny that it brings you back to the basics and that. Did you notice that yourself changing like functional states, like frequency states through the process? Do you normally change states on purpose when you do your breath work and meditations, or is it something that happens, or are you choosing it now to do it? That's a conscious choice for you?
Yeah.
Do you consciously choose to make that state change? Or does that state change happen just to you?
In terms of when you're doing the work?
Yes.
Yes. Different times, it's just responding to.
Sometimes you're just responding to what's actually going on. Yeah. Exactly. So then you can turn it on yourself at this stage. You can kind of enter that state if you choose to.
Of course.
Yeah. Okay. And so that flexibility leaves you to trust what you feel in the body.